Okay, today I'm going to talk to you about stem cells and amniotic products and PRP, platelet rich plasma, things that you've heard about before. They're starting to get a lot of news, mostly because of athletes and people traveling out of the country to get stem cells. And so I'm going to kind of explain the differences, what they are. I'm not going to get into a lot of the details, but at least this is to give you a good base to start from. So, first of all, let me say that if someone tells you they're giving you stem cells, it's not true. In the United States, you cannot inject a stem cell from another human body into your own. So in the United States, you can't actually get stem cells. What is available though is amniotic allograft products and PRP or platelet rich plasma products. Although outside the United States, I know you've heard about this from celebrities and athletes traveling out of the country to Colombia and Costa Rica to get real stem cells. Well, outside the country, you can get real stem cells. And we have relationships with a medical group, a group of doctors down in Colombia and Costa Rica for patients who need that service to travel down and actually get real stem cells via IV or sometimes even injection. So let me start off with kind of where it started and what each thing is and what it can accomplish or help you with. Well, first we're going to start out with PRP or platelet-rich plasma. There's really two types. One is a single spin, one is dual spin. Single spin by far is the most popular. And the reason it's the most popular is because it's the cheapest for the doctor to produce or the physician provider to produce. What it is they will simply just draw a vial of blood. They usually put in what's called an ACD vial, which is an anticoagulant. They will then spin it down. They will pull out usually the white blood cells along with the platelets and sometimes a little bit of the red blood cells just to make sure they got all the platelets. And then they take that and inject that in you. Now, that single spin, you typically, based on research, you'll typically see 300 to 400 million platelets. And the older you are, the less you usually have. So it just depends on where you are that day. And that's where it kind of all started was, cardiovascular surgeons, when they would do a heart transplant, they would go in and they would take PRP, they pull out a patient's body, spin it down, pull the platelets out, and inject it directly onto the sutures where they were connecting the arteries and veins and so on to help with the healing process. And it works. I mean, single spin, that's where we even started in the very beginning. And we would use it for like tendonitis, golfer's elbow, patella tendon, any type of soft tissue, even for aesthetics like wrinkles and microneedling and things like that. And it is effective. And what it really does, it just goes in, creates a lot of inflammation around that area, which draws in healing properties and it heals the soft tissue. And what it's great for is that kind of thing. Really what it's best for, we've seen is for aesthetics like hair, wrinkles, microneedling, and some minor tendonitis and things like that. But that's what most doctors or physicians, providers use because it costs almost nothing for an ACD vial. And it's just a little bit of time to drawing it out. I mean, literally costs less than $1. So that's why most doctors use it. Now, it can work. It's just usually the patient doesn't get as good a result or they have to do multiple treatments to get the result they want. Well, the next level is dual spin. A dual spin system, we were one of the first 10 in the country to have a dual spin system. And what it does, and the system we use is FDA approved, and what it does, it just highly concentrates those platelets. So we end up, instead of drawing 1 mil of blood, we'll draw like 60 mils of blood. We spin that down and we use a dual spin system, which means spun several times. So it takes about 45 minutes or so. It's completely sterile. And we end up with about 8 billion platelets. So a single spin produces roughly around 3 to 400 million platelets, whereas a dual spin system that we use produces about 8 billion. Sometimes a little bit more, sometimes a little bit less, but as you can see, it's a dramatic difference. And what happens is the patient gets a better result and with less treatments, which means it costs less as well. Because what we charge for a dual spin is about what everyone else charges for a single spin. because, well, we just feel it's a fair price, and we want the patient to get the best result possible. And um, otherwise, what we use that for typically is, again, any type of aesthetics. But if you have a pretty severe tendonitis, uh, even in the back, Achilles tendon have small micro tears, it will help with that. It can actually grow tissue over time, but it takes a lot of treatments. If we have someone who has an injury like a knee or a shoulder and needs to regrow tissue, there's a major tear, cartilage is missing, we're not going to use PRP for that. We use it really just for inflammation and help healing properties, and help that, like with tendonitis or golf's elbow, something like that, so they don't have to go to the more expensive product. So dual spin is going to give you a much higher concentration of platelet, which means it's going to save you money because there's less treatments and you get a better result. With any type of PRP treatment, when it comes to a joint, the injection is pretty simple, very simple to a cortisone shot. Very simple, very easy, not very painful. But after about 10 or 15 minutes or so is when the pain kind of hits, and it's where the inflammation is now starting to work and starting to heal it. So typically after you get a PRP treatment, they're going to typically tell you, go home and rest the rest of the day. Now, stem cells, which there are not really stem cells, a lot of clinics call stem cells is really amniotic allograft products. And what that means is they pull the cytokines and the growth factors out of an amniotic fluid, whether it's the placenta or the amniotic fluid or even the tube. Some companies even use the blood. And they will then pull the cytokines and the growth factors out of those and make a product. Well, a couple of years ago, the FDA cracked down on it hard, and there's virtually just a handful of one or two companies left. And most of those companies do it for research purposes, and there's a lot of paperwork and stuff you got to go through to even be treated with it. But there's one company who went through the entire process, spent 10 years, $120 million, and it's an FDA certified facility, and they have a product that's they're expecting to be paid for by insurance by the end of 2022 or first part of 2023. That can change, but that's what they're telling us. But they took that route to actually get an FDA approval. So that's the product that we use. And how do they get the product? Well, how they get the product is they get it from pre-screened mothers who are going to have a scheduled C-section. So they have a contract with the hospital and the mother. They go and do a pre-screen. The mother schedules to have a C-section. When she has that C-section and there's no issues, they then take that placenta, the amniotic fluid, all that material, and then they take it back to the lab immediately, and they pull out all the cytokines and the growth factors they're going to use to make the product. So it's completely safe. They've had over 100,000 treatments with no side effects. Doesn't mean it can't happen, but they haven't so far. And it's ethical in the way it's collected. So that's how they collect it. And they take those materials and they make two products out of it. One is, they make multiple products, but the products we're going to talk about today is Wharton's jelly and exosomes. Wharton's jelly is designed for tissue regrowth and repair. If you have, for example, like a knee that has medial meniscus, the cartilage has been removed, or there's still some there, it's just partially removed, or you've had a major tear in Achilles tendon or some type of tendon or tissue, or even with spinal, with disc, hip, whatever it may be, where you're having to actually regrow tissue, that's what Wharton's jelly is for. It has the ability to go in and actually regrow that tissue, even where there's no tissue there before, as long as it has something to start with. The exosomes, what that is pulled from the stem cells themselves. It's the byproduct of the stem cell. And they can do it two ways. One, they can use it as an injectable for a joint injury, or they can use it systematically through an IV, which will go through the entire body, and it basically just goes to where you need help. It helps with anti-aging, anti-inflammatory. It helps with the joint pain and things like that. There's a wide variety of things that it helps. So basically, it just goes to the body, and where there's damage or needs to be healing, it goes there and it helps that. It kind of targets that. So, and that's all done through IV primarily. We're one of the only companies or clinics in the area, even this tri-state area, that even offers IV therapy through exosomes. So that's how they get the products. That's what they do. The stem cell by far, or not the stem cell, but the allograft products, whether it's Wharton's jelly, the exosomes, blows PRP away. It's not even in the same game when it comes to healing. I mean, you can actually regrow tissue. We had a very high success rate, very high success rate. Otherwise, we wouldn't offer or use it. It can be expensive. All of them, especially the dual spin or the amniotic allograft products, whether it's exosomes or the Wharton's jelly, is expensive, but it's much cheaper than most people's deductibles, and it will keep you off the operating table in many, many cases. And if nothing else, it will at least push that operation well down the road to give you time to either, where your insurance will cover because of age or whatever it may be. But it's very effective at healing injuries and keeping people off the operating table. When it comes to the injections, whether it's exosomes or the Wharton's jelly, usually it's just like a cortisone injection, not a real big deal, and usually you can go right back to work. It's not like the PRP where they send you home for the rest of the day. This one, I've actually had the injections myself. I've gotten injections in my knee and went straight to the gym and worked out. No issues, no problems whatsoever. So with IV, very similar. After 30, 45 minutes, you can go back and work out or go back to your normal job, whatever it may be. So if you ever have any questions about stem cells, will it help my knee pain? Will it help my shoulder pain? Will it help my hip? Whatever it may be. Will it regrow the tissue? I have a tear. Can it heal that? Give us a call. We'll be glad to answer your questions. Feel free to give us a call through either, DM us through social media, through Facebook, through our website, or call us direct, and we'll be glad to sit down with you and talk to you and explain and see if there's a potentially we can help and heal your situation.